Most people think OCD means being clean, organized, or wanting everything perfect. But OCD is much deeper than that. In this video, I want to give you a simple, beginner-friendly guide to OCD. We will understand what OCD actually is, how OCD cycle works, the common types of OCD, what causes it, how it is diagnosed, how it is different from normal worry, and most importantly, how treatment and recovery are possible. What is OCD? OCD stands for Obsessive Compulsive Disorder. It has two parts, obsessions and compulsions. Obsessions are unwanted thoughts, images, doubts, urges that come into mind again and again. They create fear, guilt, anxiety, or discomfort. Compulsions are the things a person does to reduce the fear or discomfort. For example, someone gets a thought like, what if my hands are dirty? That is obsession. Then they go and wash hands again and again to feel safe. This is compulsion. Another person may get a thought like, what if I hurt someone by mistake? Then they may avoid knife, avoid children, avoid driving, or keep checking in their mind whether they are a good person. That checking is also a compulsion. So what you have to understand is that compulsions are not always visible. They can happen inside mind too. That is why OCD is often missed. Because from outside the person may look completely normal, but inside they may be stuck in a painful cycle of doubt, fear, guilt, and mental tiredness. The OCD cycle. To understand OCD properly, you need to understand the cycle. First, a disturbing thought comes into the mind. This thought may be unwanted, scary, or uncomfortable. The person starts giving meaning to that thought. They may think, why did I think this? What if this means something? What if I am unsafe? What if I am a bad person? After this thought, anxiety increases. The body feels tense. The mind wants relief immediately. Then the person does a compulsion. They may wash, check, avoid, pray, count, repeat, confess, search online, replay the memory, or ask someone for reassurance. The next step is they feel better, but only for a short time. Next, the brain learns, when I do this action, fear reduces. So the next time the same thought comes, the brain asks for the same action again. This is how OCD becomes stronger. The compulsion feels like a solution to that moment, but slowly it keeps the OCD cycle alive. So if the cycle is clear, then what causes OCD? OCD usually develops because of mix of biological, psychological, and social factors. In brain, OCD is linked to areas that help us to notice danger, detect mistake, and form habits. An easy way to understand OCD is to think it as a smoke alarm. In a normal system, smoke alarm rings only when there is a real fire. But in OCD, the alarm becomes too sensitive. It starts ringing even when there is no real danger. The person then tries to stop the alarm through compulsion. They wash, check, avoid, or ask for reassurance. For a short time, the alarm becomes quiet. So the brain starts asking for the same action again and again. Genetics can also play a role. If a close family member has OCD, the risk can be higher, but genes alone do not explain everything. Stress, trauma, major life changes, perfectionist thinking, strict environment, high pressure, and anxiety patterns can also contribute. Whatever the starting point is, the person is not choosing it. They are struggling with a condition that needs a proper understanding and treatment. How do you know if it is OCD or normal worry? Everyone has strange thoughts. Everyone double checks things sometimes, and everyone worries about mistakes. So how do we know is it OCD? You have to look for things. How strong it is, how often it happens, how much distress does it create, how much does it affect daily life. A normal doubt comes and goes, but OCD doubt keeps coming back. A normal worry may settle after one reasonable answer. OCD keeps asking for the same answer again and again. A normal scary thought may feel strange for a moment, but in OCD, the person gets stuck trying to understand what the thought means. A useful guideline to find out OCD is 1 hour rule. If these thoughts or repeated behaviors take more than 1 hour in a day, or if they affect work, studies, sleep, relationship, faith, family life and daily peace, it is important to seek professional help. The question is not just, do I have these thoughts? The real question is, how much power do these thoughts have over my life? But what you have to be careful is, OCD can look similar to other conditions. So professional assessment matters more than you think. OCD and anxiety can overlap, but general anxiety is usually broad worry about future events. OCD has repeated disturbing thoughts and repeated actions done to feel better. OCD and ADHD can also be confused sometimes. ADHD may involve distractions, impulsive behaviors, or difficulty finishing tasks. OCD involves repeated doubts, checking, rituals, and strong need to feel safe or feel okay. Other disorder which is confused often with OCD is OCPD. OCPD stands for Obsessive Compulsive Personality Disorder. In OCPD, a person believes their perfectionism, control, and strict standards are correct and useful. But in OCD, the thoughts are usually unwanted, painful, and tiring. That is why self-diagnosis can be confusing. A proper clinical assessment helps us to understand what is actually happening. Now, let's come to the most important part. A lot of people think, is OCD treatable or not? One of the most effective psychological treatment for OCD is called ERP. ERP stands for Exposure and Response Prevention Therapy. So, to put it in a very simple way, ERP means two things. One, slowly exposing the person to their fear. Second, not doing the usual repeated action. For example, if someone fears contamination, they may slowly learn to touch something they fear and delay washing. At first, anxiety rises. That is expected. But when the person does not do the compulsion, the brain slowly learns that I can feel this anxiety and still I am safe. This is how OCD becomes weaker. ERP is not about suddenly forcing someone into the extreme fear. It is done slowly, safely, and with clinical guidance. The goal of the treatment is not to remove the thought, because all of us get unwanted thoughts. The goal is to stop treating every thought like an emergency. The person slowly learns that I don't have to obey every thought, and I don't have to do ritual every time I feel anxious. Medications also play a major role. SSRIs are commonly used to treat OCD. For many people, the best results come from combination of therapy, medications, and family support. But more than all, family education is very important, because when we struggle with something, family often gives reassurance out of love. They keep saying, nothing will happen, you are fine, you didn't do anything wrong. But repeated reassurance can accidentally become a part of OCD cycle. So treatment also teaches family how to support the person without feeding the OCD. Many people ask, will OCD go away completely? This is my honest answer. Recovery does not mean you will never get a scary thought again, because all human beings have strange, unwanted thoughts. It's natural. Recovery from OCD means those thoughts no longer control your life. That means you stop spending hours on rituals. You stop obeying every doubt. You stop treating every thought like danger. Your time comes back, your relationship improves, your mind becomes peaceful. Your life becomes bigger than OCD again. I have seen people who once spent hours washing, checking, praying, confessing, and replaying things in their mind slowly return to their work, studies, family life, relationship, and a meaningful living. So yes, recovery is possible, but it needs right treatment, timely treatment, and consistency. What happens if OCD is ignored? If OCD is ignored, it can slowly grow. If you do not address it, the rituals may become stronger and longer. The person may start avoiding people, places, responsibilities, or decisions. Relationships may become strained, work and studies may suffer. Depression can also develop because living with this constant doubt is emotionally exhausting. This is why early intervention matters. You do not have to wait until OCD controls your whole day before asking for help. So let's bring everything together. OCD is not just cleaning, it's not just neatness. It is not a joke about being organized, it is like a trap. But it can be properly diagnosed and treated. So if you can relate your experience with disorder, please don't panic. And don't label yourself immediately, but also don't ignore your suffering. If your thoughts feel repetitive, disturbing, difficult to control, and if you are doing repeated actions or mental checking just to feel safe, speak to a mental health professional because OCD has treatment, and with the right help, recovery is possible.